What will be done by your party to extend the pilot study for rehabilitation of the brain injured in this province? The only rehab for the physical disability of brain injury exists in Halifax, and there are an average of 2,200 people across this province who suffer a brain injury each year. Sheila, please.
Brain injury can be due to accident, can be car accidents, can be falls in the workplace. I don't know anything specific that the Green Party would say it would do on this. I think I'm going to leave it there. I know that we would look into it and we would look at what is required, because it affects a large number of people, and their ability to maintain a normal life, they have a new normal after the accident or the injury. So a lot of rehab supports need to be put in, and also opportunities for work, or being able to be a part of the community, the stigma. I don't have anything definite to say on that.
Thank you, Sheila. Ramona, please.
Thank you. First, I want to say that the Brain Injured Association of Nova Scotia has done a tremendous amount of work in Nova Scotia around educating school children, educating the wider population on how to prevent brain injury, but also what a brain injury is. For too many years, people that have had brain injury have been diagnosed as being mentally ill, when in fact it is a brain injury. And many people who have had brain injuries have been institutionalized, people thinking that it's been mental illness, and they haven't been offered the ability for rehabilitation. We are going to continue to work with the association to make sure that we move forward appropriately, to make sure that the things are in place to make sure that people who have brain injuries can be offered the opportunity to recover and recover appropriately, and have the rehabilitation to make sure that they can contribute again, maybe in a different way. But because brain injury is so unpredictable, it is still an area that we still need an awful lot of research. But I want to say that working with the people at the Brain Injury Association, I know that they have a great deal of data, a great deal of expertise, and we are going to continue to work with them to make sure that we have the appropriate supports in place, and not confuse brain injury with mental illness, because I know that that has been a problem in the past. So thank you.
Thank you, Ramona. And Keith, please.
Thank you. I think I will keep my comments short on this, as this is an area I have little knowledge of. As an MLA, obviously, there are many areas that I will be needing to inform myself. Certainly, the Liberal Party is trying to move more money out of the top end of healthcare and get more money down to the front lines of care and putting patients first. We need a complete reorganization of the healthcare system with 125 vice presidents and directors and 10 highly paid CAOs. We are far too top heavy in healthcare for a population of $900,000. So it's with that kind of initiative to move money out of administration and streamlining. We are about to lose $900 million of federal funding in healthcare. We are reaching a crisis point here, and bold steps are needed. So we cannot nibble around the edges, and we have to begin to do things very differently. And the Liberal plan is to decrease to 2 the health boards, but to keep local community boards that have decision and influence on the decisions. And we want to empower doctors and nurses at the local level to be making decisions, and not to have it at board level. Thank you.
Thank you, Keith. Shane, please.
That's an interesting question. I agree with Keith. I'm going to keep my comments short on that as well, because I don't know a whole lot about the brain injury programs that are in place presently. I do know that we are going to create a new community care center that to bring family and healthcare together under one roof to ensure that people are being taken care of. We're reducing the top-heavy healthcare system as well, and we will be putting money back into the frontline care so there's shorter waits at the hospital and people get the care that they need. Thank you.